We often see patients with chronic pancreatitis having to explain their illness to their family and friends. So Steve, how would you explain your pancreatic disease to family and friends?
Once again, I think my family was a step ahead of me. I remember very vividly the experience of seeing you for the first time, coming in, having the scope done, and I was sort of out of it on the drive home. It was late at night. I think I was your last patient on a Friday, so it was like maybe 11 in the evening. But I was being driven home, and my wife said to me, Dr. Gardner said, you're really lucky. You're going to have a Whipple operation. And I remember sort of dozing off in the car, and the next day got up, we were going to a wedding, and I just studiously avoided it. And but that night when we got home, I went online, and I looked up what a Whipple operation was. And it really got my attention, what was in front of me. And I'm just the kind of person, I really didn't talk about it much to my friends, and my family got up to speed and was sort of ahead of me through the whole process.
Great, great. Wendy?
For me, after being diagnosed with acute pancreatitis, and my family members were looking it up online and talking to their doctors or their friends, so when I was diagnosed with chronic pancreatitis, it was kind of like telling them the same symptoms that I've had, but the pain was lingering longer. It was, it was just very painful. I just kept telling them it's just very painful. It's something, that you would not want to go through. And I would tell them that, that these are the symptoms I've had. This is what they do. They just basically tell you not to eat or drink anything, to stay hydrated with clear liquids. So it was easier to tell my family once I was diagnosed with chronic pancreatitis, because at this point they had already had an idea of what the pancreatitis was and what I was going through and stuff like that. So it was kind of easier to tell them.
Yeah. When patients have cancer or they have a broken leg, something very obvious almost sometimes in front of them, sometimes it can be much easier to explain those symptoms to your family members. And what I've heard from some of my patients is that occasionally they'll feel like their pain isn't well understood, or maybe even their pain isn't believed, whether or not that be from family members, friends, or even sometimes clinicians. And I was just wondering if any of you guys have ever had that experience, that feeling of your pain is not necessarily being believed.
I've had that.
Not so much with my family, more with the emergency room department, because I spoke with Dr. Gardner in length about this, because a couple of times when I was admitted to the emergency room, my pancreas levels were normal, but I was having this pain, and I was afraid that the doctors in the emergency room were going to label me as drug seeking.
Exactly.
So I didn't know how to explain to my doctors that I was feeling this pain, or the doctors in the emergency room, I was feeling this pain, and but it wasn't reflecting on my blood work. So it was kind of scary. And Dr. Gardner did put a note in there stating that this is real pain. This is not, a pain that she's faking, because Dr. Gardner knows that I did not want narcotics. I refused to take them unless I was in a lot of pain. So.
And I see Tina saying yes, 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 and I have to tell you that's a comment that I hear also frequently from my patients with chronic pancreatitis, that you are here seeking medications, you want narcotics, and that's a problem that makes your life very difficult.
When I would go into the emergency room, that would happen. And I wanted to get off medication, actually. Some stuff you have to take, and it's just part of it.
When you have a patient that lives away from the hospital or a significant distance, we'll go and give a copy of the initial reports or any notes stating that the patient has a real disease that goes along with a lot of pain, and that the patient is not an alcoholic, the patient is not seeking drugs, that they have a contract with us or with a pain clinic. So I'm glad you're bringing this up today.